Good afternoon, everybody. A thank you to all the organizers of COREP and for calling me on this platform to talk about the caregiver experience in chronic kidney disease. And a warm welcome to all the technicians and nurses attending. Thank you so much for having me on board. Let's start the presentation. So today we will be talking about how CKD affects the caregivers, or how caregivers are affected when they have to take care of a patient who has chronic kidney disease. I'm sure that some of these things you must already be knowing, as you have been taking care of patients with CKD, and taking care of the patients with CKD, it also involves to some extent taking care of the family also. And so we are just going to be talking about a little bit about this. So who is a caregiver and what does caregiver burden mean? Caregivers are individuals who are most closely involved in caring for a patient, and they help the patient cope with and manage his or her chronic illness. When we talk about caregiver burden, we talk about what impact the patient with CKD, what kind of impact that has on the person who is caring for them. So it can, in the caregiver, this can lead to fatigue because of the excess work that they have to do. It can lead to mental health issues like depression, anxiety, chronic stress, inability to cope. It can impair their quality of life. It can have an impact on their interpersonal relationships. This could be within family or out of family. And it can have an impact on their social relationships. Many caregivers feel isolated because they do not have the time to focus on social relationships, as most of their time is spent caring for their patient or their loved one. And so they get into social isolation. And of course, a large part of it is the financial strain. Sometimes the caregiver of the patient is the primary breadwinner of the family also. And then that means that they are not able to focus as much on earning because they end up having to care for the patient. So what tasks does a caregiver have to do throughout the patient's trajectory of illness, throughout the patient's duration of illness? If the patient is a CKD patient who is on hemodialysis, then the caregiver will have to help in taking the patient to and from dialysis. If the patient is undergoing peritoneal dialysis at home, then the caregiver needs to assist in that. The caregiver needs to make sure that the patient is taking his medications correctly, is keeping up his or her appointments with the doctor correctly. Many times, a patient with CKD is seeing multiple doctors, and so the caregiver needs to make sure that all the appointments are kept. Because patients with chronic kidney disease have a strict diet. Sometimes the caregiver is the spouse. Many times caregivers are female in our context, and then they are also tasked with the additional responsibility of preparing the food with special requirements as needed, and making sure that the patient adheres to that diet only. Sometimes in patients who are not completely independent, who need some assistance, the caregiver is involved in helping them doing their own personal care and in their activities of daily living. So whether it is bathing, it is feeding, it is taking to or from the toilet. Sometimes they may need assistance while walking. So all these also form part of the caregiver tasks. And we know that patients of CKD, patients on dialysis, are more likely to have emergencies, more likely to need to go to the hospital. And so it is part of the caregiver's work to deal with these emergencies also. So once the patient goes to the hospital, and figuring out the logistics, figuring out who will be staying with them and who will be taking care of the rest of the people at home, all these form a large portion of what the caregiver needs to do. And if we think of each of these, most of the times our caregivers have to do at least 3 or 4 items on this list. So you can imagine how much it must be, how much of a physical and mental toll it must be taking on them. So how do they cope, or what are the factors that help them cope? Here we're talking more about how a caregiver copes with their loved one's illness. So, past or current medical experiences. Do they have trust in their doctor? Do they have trust in their hospital? What has their last admission been like? Was it very difficult for them? Was it almost a life and death situation for them? Did their loved one go to an ICU for many days? All this can also affect their coping. What are the patterns of communication like in the family? Is the caregiver also the decision maker, or are they only expected to follow the decisions and there is another decision maker in the family? This may also adversely or in a good way help them cope, because sometimes the burden of decision making can be too much, and it may be worthwhile to split those roles in the family so that multiple people help to ease the burden. What is their spirituality or faith like? Do they have a strong belief system? And is that what helps them cope? Whether it is prayer, whether it is going to the temple, whether it is just remembering God, or spirituality does not have to be about God only, but just a strong belief system in their selves, or in their family, or in their patient. All these can help an individual cope. What are their cultural values and beliefs? Is their family or community supportive of the fact that there is an ill individual in the family? Are they giving them the adequate support that needed? Sometimes social isolation happens to the family of a person who is very ill. So people may avoid visiting them. People may avoid visiting their relatives. They may avoid talking about them, and that can lead to a sense of social isolation. Whereas if a community openly continues to support, maybe in terms of helping out with food, helping out with resources, helping out with manpower, all these can also affect coping of any caregiver. And the economic variables. Do they have adequate support in their workplace? Do they have insurance? Is their cost of care covered? Is it too much for them to handle? All these factors also work on coping mechanisms. So this was a study that was done on caregivers of end-stage renal disease patients, so caregivers of CKD patients, where it was found that many caregivers had at least some amount of burden, and 33% of caregivers felt that the burden was very high. This was a self-reporting scale, and it just goes to show that most caregivers feel at least some amount of burden of their loved one going through this illness, and it impacts them negatively. So what can we do as healthcare professionals, as nurses, as technicians, I've been hearing exciting news that COREP is planning to start a patient educator role, which is a wonderful initiative, and it's something that can really help patients and their caregivers as they can walk hand in hand with them. Sorry, just hold on a minute. So what can we do if we would like to take care of the caregivers who are looking after our patients? What can we do as healthcare professionals, as nurses, as technicians? I'm hearing exciting news that COREP has come up with the patient educator role, which is a wonderful initiative, and it's something that can help caregivers. They can walk hand in hand with them so that they feel the burden less. So some things that we can do is good communication, explain what is needed from the caregivers, give clear, concise, practical instructions, um, answer their questions, be available at that time when the patient and the caregiver has come for dialysis or has come to the OPD or has come in the hospital. Lend an open ear, be available to answer their questions, make them feel like it is okay to ask questions, make them feel welcome to ask questions, because chronic kidney disease is an illness which has so many ramifications on the mind, on the body, and all the information that we give will not we will not be able to give all the information in one go. We will require multiple times of where we hand over this information to them, and processing it, remembering it is also not something that can happen with each session of counseling or each time we talk to the patient. So it's important for us to remember that and think of what happens when we are handed a bad news. Sometimes we just go into shock. We can only remember up until when we have been given the bad news, and we can't remember what has been said after that. Something similar can happen with caregivers too. So good communication is key. Clear, practical instructions, talking about the illness, telling them what they wish to know, the do's and don'ts of dialysis, the do's and don'ts of PD, and then reinforcement. So we may have to repeat instructions over and over again because caregivers can forget. There is an overwhelming amount of information out there. There might have been a different caregiver the last time, and there might be a different one the next time who comes to the dialysis unit. And so we need to patiently repeat instructions sometimes. Sometimes individual or group counseling sessions can help. So if there is a group of patients at one dialysis unit, talking to them together can also save time, and it can help sort of foster that kind of bond wherein they can then interact with each other. The caregivers can also interact with each other, and they can also help each other cope. This is a wonderful way to help coping, because ultimately only a caregiver will know what another caregiver is going through. And acknowledge the burden on the caregiver. Know that it is a tough job, and say that out loud sometimes, because sometimes acknowledgement can also help. So there are many different models of communication. I'm just going to introduce one of them. I'm not going to talk about it in depth, but this is a way in which sometimes when bad news has to be broken, or when we have to explain to them something important or something serious, how do we do it? So this model of communication is called spikes. It is setting, S for setting, P for perception, I for invitation, K for knowledge, E for empathy, and S for strategize and summarize. So setting up the interview, making sure that there is adequate space, even if we have space constraints, just a small area where it is possible to talk privately. That is what it involves in setting up the interview. Making sure that you have time to talk for about 5-10 minutes. At that time, you will not be disturbed for about 5 to 10 minutes. That is what setting up means. Then assessing the patient's perception. Before we give information, we should know how much information they already have and what do they know. Then obtaining the patient's invitation. Would you like me to tell you more about this? Shall I tell you more about this? How much does the patient want to know? Then giving the knowledge and the information to the patient. Then addressing the patient's emotions, because any bad news, if it has to be processed, there will be emotions involved in it. And so we need to acknowledge that I know this must be difficult for you. I know it must be hard to deal with. Empathize that this must be a tough time for you. Just name what you see on the caregiver's face or on the patient's face. I can see that this must be difficult. Because acknowledging it also helps the individual in front of you to then process the information afterward. And then once we have given all the knowledge and information, we strategize and summarize. Okay, this is what I have told you. The next things you need to do is monitor your fluid intake, check your weight daily, and how you can do it is make sure that you have an alarm put or things like that, and then summarize the entire conversation in front of them, just so that there is a revision and a reinforcement at that point of time itself. So this is one model of communication that can help. So it can help to remember that these are the things that you need to cover when you are communicating anything with a caregiver. And then comes conflict. I think that all of us must have faced this at some point in our healthcare professional journey. It could be, we could see that there is conflict within the family, or we could see that there is conflict between the family and the doctor, the family and the nurse, the family and the dialysis unit. So within the family, what can happen is that many people can have different perspectives, different points of view about what the patient is going through. And because the caregiver is part of the family, they need to respect that or acknowledge that and then go on forward with it. Sometimes the patient can feel that people are taking decisions for me and they're not listening to me. What I want is not being taken care of. This can happen specifically in patients who have decided that I don't want to go forward with dialysis. I don't want to go into the ICU anymore the next time that I fall ill. And their family members feel that they are giving up or that they are being negative. So this is where conflict can arise with the patient and the family. And then it can arise between the family and the healthcare system. So a decreased sense of control. Once my patient gets admitted into the hospital, I don't have a say in anything that happens to him. A difference in expectations and reality. You must have seen that patients with kidney disease, their reliance on others increases after each hospital admission. So if at the beginning of their dialysis journey, they were able to walk, they were able to come in by themselves into the dialysis unit. As time goes, as they get admitted 2 or 3 times in the hospital for different complications, different issues, they become more and more reliant on others. They need help for their activities of daily living. And this can be a sense of a conflict that how is it that 5 months ago he was like this and now he is like this? So that can be something that the family may want to talk about with the healthcare provider. And then not enough information, thinking that dialysis can solve the problem, but not knowing that dialysis is just a means to sustain the kidney and it needs to be done regularly. All these kind of things can um, can create conflict. So how do we deal with it? How do we say, okay, this conflict is there? So assess the situation and say, okay, I can see that there are differences of opinion here. Would you like to talk about it? Then reinforce information, reinforce training. Do you have more questions about dialysis? Is there anything else about dialysis that I can tell you? Do you want me to repeat any of the instructions? Are you having problems with your PD fluid? Are you having problems with your weight gain? Any problems in something that may require the referral to another practitioner, to another healthcare professional? So, say feeding or diet, and then document these things in the patient care notes, and then ask again in the next visit. Okay, the last time you were having problems with your weight, how is it now? The previous time there were some issues in the diet. Shall we? Is that all sorted out? And sometimes having structured and regular support helps. So counseling, support groups, and how to introduce this is that sometimes it helps to talk to somebody who is a professional, who can take all these issues and help you solve them to some extent. And sometimes talking to somebody neutral also helps with the problem. And then refer when needed. When it seems that there are mental health issues like anxiety, like depression, talk to the nephrologist about it. See if a reference to a psychiatrist or a reference to a counselor is needed. So who can and who should work with caregivers? Anybody who is coming in touch with caregivers, anybody from the healthcare system who is coming in touch with the caregivers should try to work with them to some extent. The nurses who are in the dialysis unit, who are in the OPD, who are in the hospital, they can work with caregivers. The technicians are an excellent source of information. They can speak with caregivers and with patients about so many things that are related to day-to-day practical aspects. How to make sure that your time in dialysis is comfortable. What all you can do at home for that. What all changes you need to make in your diet. Fluid, salt intake. All these things are important practical aspects, and these are the main problems that cause hospital admissions in patients with CKD. Fistula problems or PD catheter problems. And I would, and patient educators. So since COREP is planning to start a cadre of patient educators, they would be an excellent source of information for caregivers. Dietitians can give adequate diet advice, which can impact all spheres of which can positively impact the caregivers, because they know they are empowered with the information and they know what to do with it. Counselors and therapists can, sorry, just hold on. Counselors and therapists can help caregivers cope. Regular counseling can really help them come out of chronic stress. It can help them deal with stress. And then, of course, doctors. So their nephrologists or their primary care physicians or their general practitioners, all these can give caregivers the support that they provide, that they need. And this could be not only in the sense of medical information, but a kind of support as somebody who knows about their patient's illness and somebody who knows them and their patient. And caregiver support groups. I know that Bhavna is there on the panel today, and she is running an excellent caregiver support group called Caregiver Sathi. And I would like for her to speak a little bit about this, about Caregiver Sathi. So how can you help? Tell caregivers, this is a kind of a summary of what you can do. Tell caregivers what to expect. Ask them about self-care. Ask them if they go for a daily walk in the morning, if they spend some time by themselves. help them to liaison with organizations that offer support. There are many such organizations. Help them with dialysis directories if needed, other resources like YouTube videos, which are on the kidney organization's YouTube channels. All these can help them. So these are some of the kidney foundations. There is Kidney Warriors Foundation. We have Anjali Uttup today with us. There is Sunny Kidney Foundation, Amar Gandhi Foundation, Mumbai Kidney Foundation. All of these are offering support to caregivers, to kidney patients in some way or the other. And so just to talk about, I was talking about online resources. So Mumbai Kidney Foundation has videos on their YouTube channel where they talk about simple problems, simple questions that caregivers can have. Mumbai Kidney Foundation also holds an annual day. I know that Narmada Kidney Foundation has its transplant games. And all these can help caregivers sort of bond together, know that there are other people like them who are also going through this tough time, but who are also coping. And seeing that can have such a positive impact because interacting with another caregiver can give you such a sense of hope that, okay, since they are doing it, I can also do it. So with that, I conclude my talk. Thank you very much for this opportunity.